Hi, I'm Kathleen and I'm a virtual medical assistant. I'm often asked, what exactly do I do? You know your medical assistant that sits in your clinic? I'm like their alter ego with just a few differences. I don't do any of the physical or in-person contact with your patients, but I do most of everything else. I handle phone reception and call patients to remind them of their scheduled appointments. I can work with your EMR, work with other providers and personnel in your clinic, verify insurances, and even refill prescriptions. You'll notice I'm wearing a nurse's uniform because I am an RN here in the Philippines. Most of us here at Zillium are RNs, while the rest have other professional backgrounds. In general, VMAs can have varying education similar to the MAs in the US. So when you hire people remotely, check how extensive their education and training were. Another area to watch for is where and how a VMA works. I, for one, work in an office with full security and HIPAA compliance controlled tightly by the company. Physicians that consider working with me often wonder, how can this work? All right, so think about this. Your patient calls, I answer your phone, and schedule their appointment with your clinic. I verify the patient's records, fill out digital forms, and process them in your EMR or submit to an insurance company. When the patient comes to your clinic, they are welcomed by your on-site medical assistant. Most physicians now have internet phone systems already. If you don't have an internet phone system yet, you'll have to get one so I can take patient calls and communicate with your staff in real time. You'd also want to divide existing tasks between on-site staff and me, and how well we can communicate with each other to allow me to integrate successfully into your practice. I understand that doing both the administrative work and caring for your patients can get tedious. This is where I can help. Letting me handle most of the medical assistant's job will allow you to focus on your practice. It's difficult to find qualified employees. With remote work, you'll find more candidates in an efficient way. You don't have to worry about hiring headaches, staff management, retraining, and overhead costs. Our company is structured to take care of those problems. I have an account supervisor, a client services manager, HIPAA officers, and 24/7 IT support. I am HIPAA trained and compliant with our company's security policies. I can adapt and learn new tasks depending on what your practice needs. Maybe instead of reception, you require assistance in quality assurance or customer service, so I will be trained specifically for those. If you want to know more about our HIPAA regulations and security protocols, check the links in the description below.